Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to this episode of Bristol Health Cares. I am Kurt Barwis, your host. Today we have an exciting guest with us, Dr. Edwards. Dr. Edwards is an endocrinologist at the Bristol Health Medical Center in downtown Bristol, soon to be moving over to the hospital. Dr. Edwards, good morning. Tell us about yourself.
Good morning, Kurt. It's good to be here. So, yes, my name is Khary Edwards. I've been here at Bristol for about the past year or so. So I'm originally from Trinidad and Tobago, and I did my medical school in Grenada, and then I came up right here actually to Yukon for internal medicine residency. And after that, I spent 2 years across in Dallas for my endocrinology training at UT Southwestern. And now I've found myself back here in Bristol and been having a really good time so far.
That's awesome. It's great. It's really great to have you. You're part of a two-person practice, right?
Yes.
Yeah. So plenty of business for endocrinology, I think, in the area. And access was always kind of an issue for us. So having you join us really did improve the availability of appointments for patients that were trying to get in.
Yes.
So big decision coming from Trinidad to the United States. I mean, and then endocrinology, was that like a dream for you? Was that?
No, I would say probably in med school, I had a really good mentor and actually it was a pediatric endocrinology rotation. But somehow, during that rotation, he put a love for endocrinology into me, and I knew I didn't want to do pediatrics, so I wasn't going to go down that route. And then when I hit residency and did a few endocrinology rotations, that's when it really cemented for me that I really like this field and I like working with these patients. So it kind of just went from there.
Yeah. So you came into our practice, into our group, and so talk a little bit about endocrinology and most people associate it with diabetic care, diabetes, but it's a very broad specialty, right?
Yeah, so it is pretty broad, and endocrinology is really the study of and treatment of more or less hormonal concerns. The biggest one we deal with is diabetes, both type 1 and type 2 diabetes, and then thyroid disease as well. So either if you have an overactive or underactive thyroid. And then some of the other concerns that we would deal with as well would be osteoporosis. So if people have weakened bones for various reasons, we evaluate and treat that as well. And then we also treat people with pituitary disorders. So the pituitary is one of the kind of the master gland for hormonal control in the brain. And then we also deal with adrenal disorders as well. So kind of a very broad spectrum of patients' disease that we deal with. And so far it's been pretty fulfilling.
But so in terms of the kind of patient population you see it in your practice at Bristol, do you hit all those different areas?
On most days, yes.
So on most days.
Mostly it's a lot of patients with diabetes because obviously there's a great need for diabetic care, not only in the community here, but across the country. And then you have your thyroid cases. That's probably the second most common thing that I see. And then, you have some of the rarer concerns that come up as well.
So talk to us a little bit about, diabetic care in our system, you know. So we offer the full range of services, and you hear a lot about pre-diabetics. So what should people think about in terms of pre-diabetic? Can they really avoid becoming a diabetic by doing certain things?
Yeah, definitely. So pre-diabetes is that step before diabetes, and I say it kind of more as like a warning signal that something with maybe lifestyle, weight, various stresses is going wrong, and this is a chance that you have the first signal to try to reverse things. And the thing that helps the most from our studies with pre-diabetes really is changes to the lifestyle, and a lot of times that means weight loss. It means changes to nutrition, trying to follow closer to a Mediterranean type diet, and really trying to get in the activity and physical exercise as much as you can. And for a lot of people, doing that along with weight loss is able to kind of reverse that trend and prevent the progression to diabetes.
Yeah. So there's type 1 and type 2,
Yes.
right? And then type 1 is the one where you're full-blown diabetic?
Well, yeah, so type 1 and type 2 diabetes, we kind of associate type 1 diabetes more with childhood, but really we see it across the spectrum of life. We have older patients, adults, even in the middle age and later that get diagnosed with type 1 diabetes. And type 1 diabetes really is a condition where, for whatever reason, the body just does not make any insulin at all. So a lot of times this is going to be an autoimmune disease where the body attacks the insulin-producing cells in the pancreas. And patients with type 1 diabetes, they need insulin basically to live. In type 2 diabetes, so this is a little bit different. This is usually in older patients, in people that may have had a family history of diabetes, people who may be overweight and have other medical issues as well. And in that condition, there's more of a resistance to insulin, where the body is still able to make insulin, but the body isn't able to respond as it should. And those patients, a lot of times, there's a lot of lifestyle that helps. So again, changes to the diet, exercise, weight loss, and then medications. Not just insulin, but there are a lot of other medications we could use in people with type 2 diabetes. And type 1, those patients are usually just treated only with insulin. So that's a big difference.
So if you are so type 1 is forever.
Type 1 is forever.
Yeah.
Right?
Type 2.
With our current technology, but there are some things on the horizon like beta cell transplants and other things like that kind of help some people, or pancreas transplants, but that's not really widely available.
Yeah. My brother had a pancreas transplant, and what was just kind of surprising to me was he went into the OR a full-blown diabetic for most of his life, all of his life, just about. And he came out, he wasn't diabetic anymore.
Yeah.
And it worked well for about a year, and then it didn't work after that. But the other thing that I found interesting was the original pancreas was still there and working in some respects, because it doesn't just make insulin.
No.
And then the second one was there too. He was quite happy when all of a sudden he wasn't diabetic anymore.
Yeah.
But there's been a lot of advancements in terms of insulin and care, and it seems like there's a lot of people that live a long time with diabetes today.
Yeah, definitely. I mean, they have a lot of patients in the 70s, 80s with type 1 diabetes. Maybe 40, 50 years ago, it wasn't really like that. But with all of the advancements in treatment, we really do see people with type 1 diabetes living very long lives, and type 2 diabetes as well. Type 2 diabetes, the difference that we have in treatment now compared to 20, 30 years ago is astounding. A lot of my patients, they come to me, they know that their father or grandfather had diabetes and ended up, type 2 with kidney failure, amputations, and things like that.
Yeah.
With the right treatments, now we're really able to avoid a lot of those complications.
So the signs, for the public, the viewing public, what should they be looking for in terms of aside from they really should be getting an annual physical and things like that. But what are the signs for people that maybe they have early onset or, a condition that they should be saying, wow, this is really a call to action. I need to get on the phone and talk to somebody.
Right. So, there's signs and symptoms, and this would be for kind of more advanced cases where you really do need treatment fairly quickly, would be things like excessive thirst. So all of a sudden you can't get enough water in.
Yeah.
We also see people with excessive hunger as well. And then some people have excessive urination also. So it's kind of this combination, you're drinking a lot, you're urinating a lot. And then in really significant cases, people may have weight loss despite not really trying to lose weight, despite eating more. And these are conditions where it's really a sign that the body is quite resistant to insulin and an intervention is needed. But the fact is, for the vast majority of people, they're not going to experience these signs. It's, as you say, really on your annual physical is where some of these things come up. The story I hear most from patients is, I had lab work done and I had a high blood sugar, or I had a high hemoglobin A1C, one of the other tests that we do. And this really hones in on the importance of, regular checkups with your doctors. If it's been a few years since you've had your annual, or you've seen your primary care or had blood work, you really should get in and get checked so that, if anything comes up, we're able to treat it very early and get the control that is needed.
Yeah, you were saying about drinking a lot of water. I remember we were at a Cub Scout dinner, and my brother was, I think, 10 or 11. And the way we knew, well, I didn't know, but my parents knew. My dad was there. He was like a troop leader. My brother went down the table and drank everybody's water and milk and stuff, and he couldn't get enough water. And I remember going home, my mom being a nurse, and my dad saying, something's wrong with Harold. I mean, he did all and that, and she knew immediately. The next day, he was off to Children's Hospital in Philly, and that was it. So, so there's a lot of hear a lot now about managing weight and weight loss, and there's this whole new kind of bag of tricks with these medications. Talk a little bit about that.
Okay, so in the context of diabetes, now, well, I'll talk about with and without diabetes, but with diabetes, the American Diabetes Association now has weight and obesity really as kind of a first-line target that we should be treating in people with diabetes. And over the last 5 to 10 years, we really now have medications that address that. Previously, most of the medications for diabetes, unfortunately, led to weight gain or made it harder to lose weight. But now many of the medications that we use are able to either be weight neutral or actually promote weight loss. So, we see a lot in the media about medications like Ozempic and other medications in that class, where those medications kind of mimic natural hormones that your body releases after you eat. They help to reduce your appetite, they help to make you feel full with less food, and they help the body release its own insulin as well. So this is why it's such an effective medication for people with type 2 diabetes. And the weight loss that you experience with this medication for most people is usually pretty good. Now, in terms of people without diabetes, we have a few other options as well. So the FDA-approved options would be a medication like Wegovy, which is quite similar to Ozempic, and then there's another medication called Saxenda. And with these medications, now people are able to get weight loss anywhere between 10 to 15% of their body weight, which in terms of the meds that we had before for weight loss, the best we would be able to experience is about 5 to 10%. So these medications are actually working really well. And there are a few things in the pipelines that really are able to sort of mimic the weight loss that people would have gotten with bariatric surgery. So really, we're living in a fantastic time, and I think in a few years, we will have a lot of really robust treatments for obesity.
Yeah, it's really, it is as you said, exciting and really interesting time. So and I'm not a clinical person, but I read that those hormones, they actually slow down the digestion itself so that the stomach remains full. So the food's still there. Is that essentially how it works? Is it makes you feel full that way?
So yeah, it does make you feel full that way because it does delay the emptying after you eat something. So yeah, the food takes a longer time to go through your system, and then you feel full with eating less. So, I would say one caveat is if you are on these medications, certainly you have to let your other doctors know in case there are any side effects that could be related. If you go in for surgery as well, this is becoming an important issue that we're still investigating, particularly with the risks with anesthesia. So you always want to let your medical care team know that you're taking these sorts of medications for diabetes or for obesity.
Yeah, I've read a lot about that you have to stop the medication a long time in advance before you're going to have like a scheduled or elective surgery, just to make sure you don't have a full stomach when you're going in.
Definitely, you want to talk with your anesthesiologist and surgeon, but I guess the anesthesia societies, they recently released guidelines that do say yes, for some of the medications you may want to skip the dose the week before, for others the dose the day of. But the fact is that these medications do stay in your system for a little bit longer than that. But again, this is just precautionary, and you just want to go with the advice that your specific anesthesiologist and surgeon is giving you.
Right.
And then, of course, always speak with your endocrinologist or primary care doctor, whoever is managing your diabetes, if you have to make these adjustments before surgery.
It's maybe in my kind of lay thinking process. So you're making the person feel more full, so they don't eat as much.
Yes.
And with a bariatric surgery, you're reducing the size of the stomach, so you feel more full, and you eat less. So it really is kind of amazing that you get almost the same place in a very different way. Less invasively, of course.
Yes and no. So, I mean, it's a lot more complicated than that. And, I think there's still a lot of investigation going on. So some of these medications, they do act at the level of the brain as well to reduce sort of what sometimes people refer to as food noise, where you're always thinking about your next meal, or so it does reduce your hunger that way as well. Surgery, not only does it reduce the size of your stomach, but surgery actually also changes some of this hormonal balance as well. So surgery isn't purely a mechanical shrinking. So at the end of the day, though, surgery is a tool that shows the most durable and sustainable weight loss. It's not right for everybody, and it's the same thing with these medications. They aren't right for everyone, and you always want to have a very considered conversation with either your primary care or whoever you're seeing to help manage this, so that you make the right decision for you.
Yeah, it's and what if you go back to the beginning, the real impact, and what I hear a lot about is, people that had blood pressure medication and had other issues, when they go through this weight loss process, a lot of those things resolve themselves, including they are managing their type 2 diabetes to a much better place, right? I mean, can they actually eliminate the need for any kind of other medication if they lose enough?
If they lose enough, yes, you could, cut back on a lot of the other medications that you take. And again, this is for each patient, mileage may vary. So I do see some people who are able to come off of blood pressure, cholesterol medications, some of the diabetes medications as well. But, again, this is going to be working very closely with your bariatric surgeon, with your medical doctors, to, again, make the decisions that are right for you, and not just to have an expectation that you're going to really be off of all medications, because depending on how long you've had some of these diseases, you could certainly reduce the medication burden, but sometimes not always eliminate it.
Yeah, I mean, it's still really positive too, because the other thing I hear a lot is, people, they're out walking their dog, they're doing things that maybe they weren't doing before.
Yeah.
And so that kind of excites me, because giving a person their life back, and being able to spend time with their kids and others in a different way is really exciting. Yeah. So we didn't talk about thyroid that much, but I'm curious because so there's another area of a lot of focus, and I hear a lot about that. So how does someone know that they have a thyroid condition, like either hyperthyroid or hypothyroid, I guess?
Right. Okay, so I'll start with hypothyroidism, because that's more common. I think everybody probably knows somebody that has it, or maybe there's a family member or something like that. And unfortunately, the symptoms of hypothyroidism are what we refer to as non-specific. So, these are symptoms that could be from the thyroid, but unfortunately, they could be from other things as well. But the symptoms that you'd be thinking about there are kind of just really sluggish, difficulty concentrating, significant weight gain, out of the ordinary, feeling very cold all of the time. You just overall feel like, say, like a clock winding down, so to speak, is how I've heard some patients describe it. Right? And then with hyperthyroidism, you have kind of the opposite symptoms. And this is kind of like if you're speeding down the highway at 100 miles per hour, where you feel your heart rate kind of pounding out your chest. You're anxious, you're jittery, you're shaky. You may have trouble sleeping. You may be hot all of the time and sweaty all the time. And, if you have symptoms like that, this is a sign that, you need to talk to somebody and get your lab work done.
And so both of those almost seems like extremes, like polar opposites of each other, are treatable with medication. And, okay, so that's really good. And if it goes untreated, the consequences are can be pretty severe. I mean, a person, if they're winding down the clock, that affects everything, their lifestyle, everything. And on the other end, you're just probably driving everybody else crazy, right?
But hyperthyroidism, so when the thyroid is really overactive, if it is severe and it's untreated for a long time, the consequences could be pretty dire. You could go into something called thyroid storm, where everything just goes way into overdrive, and that could be a deadly condition if untreated. And then at the other extreme with hypothyroidism, sometimes people experience something called a myxedema coma, where they could become unconscious. They could have very low blood pressure, very low body temperature, things like that. Luckily, these are conditions we really don't see happening that often anymore, because most people getting their thyroid labs done probably on their annual visits, or if something's wrong, they bring it up with their physicians. So really, luckily, we don't see those two conditions that much anymore.
So we're running out of time here, but Dr. Edwards, any last message to the viewing public?
And I would say the first place you always want to start is having regular health care. The primary care doctors are the ones that are really on the front lines, and they pick up a lot of things. Most of the patients that I see coming to me are the people who they didn't see a doctor for years and years, and then these things get picked up. Right. The other thing is that there's so many different options now for treatment. So, if you want to try something different, if you think there's something else that could be done, you bring it up with your doctors, you have that conversation. And if you think you'd want to see a specialist, you could ask your doctors for a referral, or you could call into our office as well.
Dr. Edwards, thank you so much. I think we could probably spend a half a day talking about this, or even more. That's been great, very informative to me. I appreciate that. Thank you for watching this episode of Bristol Health Cares. You can write us at cares@bristolhospital.org with any of your suggestions and ideas about what you'd like to hear about in a future show. A special thanks to Nutmeg TV. It's a great organization. They do an awesome job of promoting all the events in the community and really bringing messages to you. And so it's a great organization that you should absolutely support. Thank you again for watching this episode of Bristol Health Cares. Until the next time, I'm Kurt Barwis. your host, Kurt Barwis. Today, I have a very special guest, Dr. Andrew Lin.
Hello, and welcome to another episode of the Veterans Corner. My name's Chuck Wooden.
Decision for ourselves for this week if we want to be made well.
Hi, welcome to the crack of dawn. It's Dawn Lombardi. I'm starting the painting. It's going to be the clips with some water. Love it.
He took me on the sets of Lost in Space, Batman.
Everybody has a story. What's yours? Until next time.